an hour and a half for a patient visit?
All right. Great question, Jason. All right. So the reason at any doctor's office, why would it take about an hour to get seen? It's because there's a lot that happens in the background. A lot of times patients don't recognize is that there are forms that needs to be completed, insurance that needs to be reviewed again, ID that needs to be scanned in. So imagine you have an appointment at 8 o'clock this morning. Perfect. There's going to be, when you walk in, the receptionist is going to spend about 10-15 minutes checking you in, collecting your payment, collecting your insurance card, ID, scanning it into your system for you to complete some forms, consents, financial responsibility, potentially some screening questionnaires that you may be required to do. So give it about 15 minutes. What happens next? The medical assistant is going to take you back to get your vitals completed, get your weight checked. They'll add in medications to your, if there are any changes to your medications, they're going to put it to your chart. They're going to go through your medications and review that. Are you still taking the medications that you were on your past visit? So potentially getting an EKG done. So that would take you another about 15 minutes. So since the time of your appointment, 30 minutes have lapsed already. Now, of course, our providers are also busy. So, granted, everything goes well, and they're literally just waiting outside of the door for you, which you have to agree it's not going to, no, 9 out of 10 chances that's not going to happen. They're busy doing one thing or another, being with another patient potentially that they're running behind from because they were just required to disclose unfortunate findings, or just be with that patient that needed some extra few minutes. But nonetheless, say the best case scenario, they're literally waiting for you outside. Now they're going to spend about 15-20 minutes with you. So now we're already close to about that 45 to 50-minute mark. All right. Another 10 minutes to do checkout, to make your follow up appointment, to give you your imaging report, to get you over to lab, etc. It's at least on a perfect scenario, it's going to be an hour long process. So guys, I mean it with the most respect. This is not Starbucks. You're not coming over to here, putting in your coffee order, collecting your coffee, and moving out the door. You're coming over here for your to be seen by your doctor. There is a lot of things that happen over in the background, which of course will take time. Now, one way may make an argument that, well, this concierge doctor says they're literally waiting for me outside for to cater to my needs. Yes, that's going to cost you $2,400 a year for that service. Neither of us can afford it. You can't afford it. I can't afford another $2,400 a year for primary care services and pay your insurance premiums and everything. It doesn't work that way. Okay. So please understand there's a reason to why it takes about an hour to hour and a half for your visit. I hope this helps.